evening. Please have a seat. Before we start, I would like to introduce myself. My name is Maria Janie Sabal, your nurse student for today, and you are?
Hi, Kate.
How would you like me to call you?
Just call me Kate.
Alright, let me just double check a few of your information. So, how old are you?
I'm 18 years old.
Where do you live?
I live in Arcastillo, Antag.
And your birthday?
July 30, 2003.
Are you married?
No, I'm single.
Okay, great. So, before we go any further, I'd like to inform you that in order for me to assist you today, I have to ask you a few questions, specifically about your health and medical history, as well as some of your personal statistics. Will that feel right to you?
Okay.
I'll take note of your replies so we can come up with the best plan to take care of you.
Alright.
Okay, so let's get started. So what brings you here today?
Well, I come here today because I am having a problem with my severe stomach ache.
Okay, and how long has this abdominal pain?
I suppose it's been 3 days already.
If you were to point me to the area where it occurs, could you please point it to me?
Right here.
Okay, in your lower abdomen area.
Yes.
Does it hurt anywhere else?
There's a burning sensation when I'm urinating.
So, if you were to describe the abdominal pain for me, what does it feel like? Is it like throbbing, stabbing, or squeezing, perhaps any?
Well, it's like cramping.
Okay, sounds like a cramping pain in the lower. So if you were to rate the pain on a scale of 1 to 10, with 10 being most painful and 1 thing less, how bad is the pain that you feel?
It ranges from 7 to 10.
So, what are the events that trigger your abdomen? Like, what were you doing at that moment?
Last Monday, I drank 2 to 4 glasses of Coke.
What are the things you do to lessen or ease the pain? Do you take any medications or do you just rest to eat?
Yeah, 3 days ago, I went to the pharmacy and I bought the medicine. So it is Cotrimoxazole 2 times a day to alleviate the abdominal pain.
Okay, thank you for that. Okay. So for the next part of this interview is about your past. Just a few questions about your past view. Are you presently under the supervision of a healthcare provider of any medical illness?
Well, I have never been admitted to the hospital because of illness or disease.
Have you ever been diagnosed or having an illness like diabetes, heart problems, or asthma like that?
No.
And I suppose you also don't have any maintenance medications.
No.
Have you ever had surgery? What type?
I haven't experienced having surgery and I wish not to.
Okay, are you allergic to any medications, animals, foods, insect bites, bee stings, anything in the environment, or anything that we touch?
Since I was a child, I don't have any allergies whatsoever.
Have you ever been diagnosed with an infectious or communicable disease? Alright, let's proceed now to your experience of injuries and accidents in the past. Have you ever been involved in an accident, or have you ever been injured in any way?
Only minor ones like cuts.
What occurred did you lose consciousness?
It was caused by broken glass, but it wasn't serious.
Did you take any precautionary measures? What are they?
At that time, I didn't because I was young.
Were you hospitalized for how long?
I wasn't, but to avoid the infection, I rested and picked my food.
Were there any complications? What are they?
There are no complications because I kept my wound away from possible infections.
Were there any long-term effects from this injury?
Only scars.
Have you ever sustained injury in a car accident?
I never got into a car accident.
Have you ever had a broken bone?
I have not experienced those yet.
Have you ever been assaulted, raped, shot, or stabbed?
Never.
Have you ever been bitten by an animal or insect?
I have been bitten by a cat once, but I was fine.
Okay, we're going to another set of questions, and that is all about special needs. Do you have any disability or special needs?
No.
What about blood transfusion?
No.
I guess we will continue to another set, which is childhood illnesses
Okay.
experience. What immunizations have you received since birth? When?
I have received vaccines for vitamin and anti-measles.
Did you experience any reactions to the immunizations? What were they?
I only have a fever after the immunization.
As a child, did you receive the following immunizations like MMR, polio, smallpox? So much for that.
No.
Do you receive any immunizations as an adult like varicella, Hep A, Hep B, influenza?
No.
When was your last TB test, and what's the result? What is the result?
I don't have any results for that because I've never been at
Have you received a vaccine like BCG?
No.
Have you ever received any other immunizations, perhaps prior to visiting a specific geographical region?
No.
What about alcohol, cigarettes, or drug intake?
None.
Experience domestic violence or intimate partner violence?
None.
Sexual practice or preference?
None.
What about travel history?
I have no travel experience.
What are your physical activities?
I like brisk walking and watching movies.
What are your stress experience?
Only financial stress.
What are your coping mechanisms?
I just sleep and go out.
What are your economic status?
Lower middle class.
Religion?
I am Catholic.
Are you affiliated with a specific religion?
No.
Do you currently practice your faith?
Yes.
Do your religious belief affect your health status? In what way?
None.
Are there any beliefs that you will feel are compromised by seeking health care?
No.
Are there any religious practices you may need assistance with?
Only going to church.
What are your ethnic background?
None.
What are your roles and relationships?
I'm a daughter and a sister who works hard and do anything for her family.
What about your patterns of daily living and functional health assist?
My typical day is slightly productive, sometimes fun, sometimes not.
Do you need assistance with any activities of daily living?
When at work, yes.
Do you socialize, meet, or talk with people outside your house on a daily basis?
Yes, because of my work.
What about your schedule? Did it change on a certain days or the weekend?
Yes, if I change my day on a specific date, my schedule might change.
Let's go to the last. It's about health maintenance activities. How many hours do you sleep?
7 hours.
How many hours do you exercise?
Usually in a week, I work out for 2 hours.
What are your stress management?
It ranges from 7 to 10 on management stress.
Do you use any safety devices?
Only anti-radiation specs.
Okay. Do you do health checkup?
As of now, no.
So, okay. I'm just gonna state what you said to me. So, you've been having abdominal pain for almost 3 days. The pain is around 7 to 10, right? So, the abdominal occurs when you drink 2 to 4 glasses of Coke. And then you try to rest and take a medication to ease the pain. And so much for that. Just wait to call your name for further interview or test. Thank you.
Thank you.
Thank you.